All right, welcome everybody. Hope everybody's having a good conference. My name is Tim Proctor. I am product owner at PCC, working with our reporting products and our forms products. I have a lot of experience at PCC doing support and consulting and working with a lot of practices on data and reporting. I've also have experience with the dashboard as a developer of the dashboard. So we're going to talk about all things reporting in this session, focused on the financial side of things. So I'm hoping that this will be an introduction to folks for various operational and strategic financial oversight reports. We're going to be in the EHR, focused on EHR reports. There's going to be a few practice management reports we're going to get into as well. So the good thing is that we at PCC are focused over the last many years on getting reports and functionality out of the practice management side to the EHR. I'm happy to say that we have a lot of good productivity reports and other financial reports that are in the EHR now. This is the first year I can actually present many financial reports from the EHR, so excited about that. So we're going to get into that. I'm hoping that everybody also thinks, as I go through and talk about various measures, you're thinking about ways that you can improve your practice, or identifying, recognizing measures or areas that you might want to dig into a little bit more at your practice. And we're going to have an opportunity right after lunch for a walk-in clinic for reporting. We're going to be there. We're going to have a lot of folks, PCC folks there to help you with reports. That's a good opportunity to ask us questions and dig into things a little bit more. This session, we're going to talk about all of these different reports. I'm going to make you, give you an introduction to those, how to find those. We do have some exercises. We probably won't have too much time to dig into workshop style exercises in this session. Maybe towards the end we would, if we have time. But in your app you'll see a link to an exercises document, and that just has some sample reports that you can experiment with after. But my presentation is broken out into three different sections. We're going to first dive into billing oversight reports. And that's really going to be information necessary to oversee and improve the billing operations at your practice. How many folks here were at Ben Brandt's billing report session yesterday? So there'll be a little overlap with that. So you'll see some of the same reports. And I'm going to focus on some of those first. Then we're going to move to productivity reports. I want to emphasize and show how to gather data about provider charge productivity, payment productivity, visit reports. We'll talk about getting RVU and E&M coding reports and patient counts and things like that. So that's information about productivity at your practice. We'll get into that. And then finally, we're going to get into the strategic financial reporting side. This is going to be like the high-level measures of revenue per visit, revenue per CPT code, payer mix, pricing analysis. A lot of this information is in the dashboard, so we're going to get in there too. So this is sort of the plan for this presentation, and we're going to get into a lot of those different reports. You may be wondering, okay, which oversight reports should I run and how often? If you're a new practice with PCC, you may not be familiar with what we recommend that you look at on a regular basis. This link here in this QR code will take you to a learn.pcc.com page that we put together last year sometime, but it really breaks up recommended reports and the variety of PCC reports that you can run daily, weekly, monthly, quarterly. So if you're looking for just a list of reports to run, this is a good resource for that. I'll leave that up for a second as I see some phones trying to scan that QR code. All right, let's get into some billing oversight reports. First one I'll mention is it's good to have a process or a person that is reviewing your charge posting at your practice and coding. All right? Are you capturing all of the vaccine admin codes you should be billing with your visits? Are you capturing all the screening codes? This is something you can spot check this right in the EHR. It's just it is time consuming and tedious, but going into each visit and looking at what was actually posted for that visit, you can see here with the screenshot right from the schedule screen, as visits are posted, you click that posted link and it'll get you to what you see below, which is just a list of CPT codes that were posted for that visit. It's good to have an experienced coder or biller looking at this just regularly. And this is a spot check, right? You're just making sure that you're not missing coding opportunities. So that's an important one to look at. We have a report on the practice management side called Daily Check. This is meant to be a really, really long report that just shows all of the visits that were billed out. I don't know if I have a screenshot. Yeah, this is what that looks like. You'll see a section for each patient in each encounter that was billed out with the diagnosis codes, the CPT codes, the amounts. So again, it's just you're making sure that you're capturing all the codes that you should be for different types of visits. Okay. Another billing report, claim rejections. Are there claims that need correction or that need follow-up? Okay. In the EHR, under the claims tool, there's a tab that says needs correction. These are claims that haven't yet made it out of your system. All right. You've sent the claims, or you've had your billing folks have sent the claims, but they've been held up for one reason or another. Okay. The patient, and these are some examples here in the screenshot. The policy may not be active on the particular patient being billed. The effective date might not be accurate. The certificate number might be missing or not the right number of characters. So there are some checks built into PCC for claims before they get sent out of your system. So this is good to review regularly to fix those problems that are holding up claims. We also have on the practice management side what's called a billing error report. You'll see this in SRS billing and collection reports as the claim error report. I'm happy to say that I think in the next release, Kelsey had talked about this yesterday in the What's New, What's Next. We have this report coming, or work list essentially, coming into the EHR with the next release this fall. Right now, you have to get this in the practice management side, but this essentially identifies claims that you've sent out that the payer has rejected for some reason, or the clearinghouse has rejected for some reason. There's something wrong with the claims after you've sent them out, okay? And this is just meant to be a work list, a list of claims that need follow-up. The insurance may have rejected it because the patient wasn't recognized as effective with that insurance and so forth. Billing folks should be running this regularly. I say every few days, but you can run this daily, you can run this every other day. A really essential billing oversight report to be looking at. And again, this is coming to the EHR. I don't have screenshots of what that will look like in the EHR because it's actually being developed right now, but coming soon. Encounters by billing status. Okay, so do you have encounters that happened that the provider may have finished and the patient's gone, but they haven't actually been billed yet? You're billing, so with your normal workflow, all right, the providers chart the visit, they make ready for billing, right? They click the link the diagnoses and put all the procedures in, and then they say make ready for billing. The biller then needs to actually send the claim. This report is designed to show encounters or visits where either the provider hasn't made ready for billing yet, okay, or the claim hasn't gone out. Maybe the provider finished, but the billing folks haven't actually entered the charges. Okay, you can run this report. There's different statuses. Give it a date range. You give it a provider filter if you want, or a location filter. But you see on the right there, you have different encounter statuses. So you can say, Show me encounters that are ready to post or have new items added to it. These will be encounters that your clinicians have finalized but haven't been fully charged out yet. Or if you say filter on not ready status, all right, this will be encounters that the clinicians haven't yet made ready for billing. All right, so this probably happens often at your practice where you have clinicians that are just not completing their charts, right? And if you want to report or to identify all of those, this is the report for that. You can go back in time. You can run this filtered to a specific provider, hand them a report, say, hey, you have 20 visits, these 20 visits that you need to finalize, okay? It's very important, obviously, to make sure that the visits that actually happen are actually getting billed out and completed, all right? This report is good for that. Okay. If you have questions, I should say, actually, raise your hand. I'm gonna try to keep us moving because I know we have a lot of content. But if we have a good time to answer a question, feel free to raise your hand or ask. For folks that are streaming, feel free to put your questions in. We're going to have some time at the end, hopefully, that we can get into questions too. Yeah. That's in, it's in the claims tool in the EHR as a tab. It's a work list. Yeah, those are claims that haven't yet been sent from the system because of one error or another. Payment reconciliation. So let's talk about payment posting and sort of proving out at the end of a day. So for the front office, people collecting co-pays, front office payments, cash, credit card, checks. There's this report called Payment Reconciliation, meant to be used to reconcile front desk payments. All right, you run it. You can filter on different payment types, different users if you wanted to. And as you see here, it's designed to show front office payments and individual payments along with totals. At the end of a day, I always recommend it that each person working at the front desk run this for themselves. Make sure that what you've actually collected in hand matches what's put into PCC. This will catch typos, like if a payment was entered incorrectly, or a payment wasn't, that you've collected a payment but actually didn't post it. You'll catch those issues. Okay. You got a question? Yeah,
we have a question online. Will claims show up in the claims tool even if our claims are sent through PM, practice management?
Will claims show up in the claims tool even if sent? I believe the answer is yes, but we should confirm that. I don't see any billing PCC folks here. You don't think so? Okay. I know with a lot of stuff we've sort of built sort of a bridge. Yeah. And the person who asked, I would say, go check. Like, if you're sending it from the practice management now, just take a peek over in claims in the EHR and see if anything's there. Okay, insurance billers. Okay, so we have some payment reconciliation tools for insurance billers that are posting insurance payments. We added these last year in the report library in the EHR. Payment totals by check number is designed to compare all of the insurance checks that you're posting. So you may have like a $5,000 Blue Cross check that you auto-posted in PCC. You want to make sure, or maybe not all of that auto-posted. Some of it auto-posted, but then you have to manually post some things for whatever reason. You want to make sure that that full payment, that full check got posted in PCC, that you didn't miss anything. This report is designed to show payment totals by check number, group by check number. Okay, so you can run this after you have a biller posts a large check, they run this to see, does this report show that full amount of the check? Okay. Often they will, like I said, the example, like they'll auto post some, the system will auto post some, but some things that can't auto post, all right? They have to manually post. They want to just make sure that all of those manual posts were entered in there for a given check number, okay? If a biller runs this report, it doesn't match what the ERA total was. There's a payment details by check number, which is designed to show every single payment with that check number. Okay, so you can go through and compare to your actual ERA, your EOB, to make sure that all of the individual payments on that remit were actually posted. Okay, so this is getting into some day-to-day sort of billing reporting and reconciliation. It's really important that billers, not just front office, but billers are making sure that all checks are being posted. Okay, these EHR reports are designed to help with that process. All right, allowable underpayments. So this is more of a higher level billing oversight report. So how many practices, just a show of hands, are tracking allowables on this would be on the practice management side in Allow Edit? Ooh, I only saw one hand. Okay, maybe 4 or 5. All right, so if you are tracking allowables, which is a good thing to do, we've had this functionality in PCC for a long time. And this is just tracking what you're expecting to get from each insurance for every procedure. If you're tracking that, we have a report that is designed to show the payments coming in and the stored allowable, and if there's a variance, if you're getting a payment less than a stored allowable, it will identify that on this report. Okay. Not many people were using allowables. For the people who are not using allowables, Tori and I are very interested in hearing this. Are you interested in tracking this, but just don't?
We didn't know about it.
Okay.
In the past, it blew up auto post. Like there was a time. I mean, I was looking at 2010. That's when I did this last. There was a time when it would like hit against, like if the payment in the auto post came in different than the allowable, it would be manual.
It would block it and not allow you to auto post.
But I think that's fixed.
There's configuration options for auto posting with regards to allowables. This is something that's in practice management. It's not in the EHR yet. We're considering adding this functionality to the EHR. Yeah, Tori.
Yeah, we've got another question from online. Will you be covering how to run a report to see what has auto-posted?
Will I be covering how to run a report to see what was auto-posted? Yes, so the one I just talked about here, these reports, payment totals and payment details by check number, will reflect what is auto-posted. It also reflects what's manually posted too. It's just a total by check number. There are, with the ERA auto-posting workflow and work list, you can see the checks that are waiting to be auto-posted, and I believe it shows amounts that had been posted. So I think a good response, if you're not familiar with auto-posting in the EHR, talk to our billing support folks or your CA. They'll get you more familiar because you can track what had been auto-posted versus not individually by check in the billing tools. I'm not going to get into that too much.
Can you filter by showing take back and auto post?
Before you answer that, Tim,
What's
I'm
that?
going to bring this mic over so we can
Oh,
have this
okay.
question be heard at home.
Yeah.
My staff reported some issues and errors in auto posting of takebacks, and I'm wondering if there's a way to filter a report down just to show the takebacks.
Yes. So and my answer is going to be the same to that. I believe you can get this within the work list of auto posting, where you can say, show me only takebacks, show me only auto posted things. For more detail and hand-holding with that, talk with our billing support folks or CA. But yeah, that tool, that work list, auto-posting work lists, was designed in a way to be able to filter different types of things, including takebacks. Okay, talked about this, allowables, we talked about this. So yeah, these reports are designed to show underpayments from allowables or overpayments, but you have to be tracking the allowables. Yeah, this is an example of how that report would look, where you see by CPT code, by insurance, every individual payment, and if there's a deviation from that allowable amount, you'd see that in its own column. Reviewing payment and adjustment trends. So we have a report in the report library that's designed to show total payments or adjustments for different types. Okay, have you ever been interested in seeing, okay, how much bad debt adjustments am I doing at the practice, or which users are posting bad debt adjustments, or show me the trends in different types of adjustments. This report is designed to do that, and you can see a sample here. It's just a subtotal of total adjustments or payments by type. Okay, you can filter on different classes, adjustments, payment types. So it's not just for adjustments. You can do this for total payments. I think some people use this for, like, if you're getting capitation checks or incentive money or other bonus checks, and you're posting those with special payment types. This report can be used to just get like a trend of that. The version on the screen here doesn't have a monthly trend, but you can customize this to show monthly trends in these different payment types. Okay, this is a fairly new report we added. Did you have a question? Okay. All right, let's talk about dashboard a little bit. Just a show of hands, who regularly uses the dashboard? All right, if you don't, this is accessible right from the EHR under the reports menu. We update it once a month, okay, at the beginning of every month. It's actually the first Saturday of every month is when the data automatically collects from your system. It gets loaded into the database Tuesday, Wednesday, the following week after that first Saturday. But really what it is, it's a tool to inform all of you of your financial and clinical health, relative, based on your relative performance in a variety of areas. So there's benchmarks, they're for a variety of measures, really useful high-level tool to really get a glimpse of how you're doing at the practice and your trends. Yeah, so you have a login you can access right from the EHR. Like I said, when the data is loaded there. The benchmarks you see are all PCC client specific. So they're all pediatric benchmarks. You're going to see averages and top 10% benchmarks. And clinical measures are accurate right away. So if you're a new client, started with PCC, financial measures take a little while to have enough data to be accurate. Clinical measures should be accurate right away. Like I said, we have benchmarks. Sometimes we have HEDIS benchmarks for certain things. These haven't been updated in a few years, so some of these may have changed. I think this example here might be immunization rates for kids at 13 years of age. We have PCC average, top 10%, and other benchmarks. Scoring, so we have a scoring system. All of your measures on the home page, right in the dashboard, you get a score. It's displayed from lowest to highest score, variety of different measures. And I will mention this, Chip's going to talk about this when we give dashboard awards at lunch. The financial pulse, I don't know if I have a screenshot of this. I don't think I do. Your home page has an overall pulse, financial pulse, and an overall clinical pulse, which is like an overall score for financial versus clinical areas. Everybody's financial pulse is going to see a drop over the next couple months. We're about to shift the scoring methodology for revenue per visit and pricing. These measures, we haven't adjusted how we score those over the years. The benchmark has changed. The pricing benchmark has changed over the years. Revenue per visit has changed over the years. Practices were getting a score of 100 for those measures when they were like below average. So we had to change the scoring a little bit. So your financial pulse for everybody will show a little bit lower. Don't be alarmed on that. It's everybody's getting that adjustment. And it's just because the benchmark has changed. Talk about AR a little bit. I have some slides that talk about some AR reports, AR measures. In the dashboard, there's an AR days measure. Okay, what is AR days? Essentially it's the amount of time it takes to collect the money that is owed. It's a representation of how much days of accounts receivables charges that you have outstanding, unpaid. In the dashboard for any of the AR measures, if you scroll down, when you click on the AR measure, scroll down, there's a related tools section with a link to detailed AR summary report. This can be really useful if you want to kind of drill in a little bit more on some of that billing AR measure. Okay. These are a couple graphs that you'll see in that AR breakdown report. If you wanted a breakdown of AR percentage by aging category, so current, 30 to 60, and so forth, you'll get a graph of that with your practice versus the benchmark. Yep. So the question was, where do I find this? I'll show you real quick.
The AR charts. See that.
I don't know if I have. In any AR measure, is this going to work? No. All right. I'll get logged in separately. Any AR measure, you scroll down. So you click on the measure, you scroll down, there's a related tools section, and you'll see a detailed AR breakdown link in the related tools, bottom right of the page. And when you get to that, you'll get to a longer AR detail page with a lot of different data. This is a couple of them. These are some really cool and important metrics for AR. And it's like the one on the left is your percentage of total AR in each category compared to the benchmark. So how am I doing as a practice for my over 120-day AR compared to the other practices? Okay, this example shows that this practice has a pretty good AR, like 9% of their AR is over 120 days. Well, the norm, the average, is about 25%. So they have more current in 30 to 60 as a percentage for the practice, but that's not necessarily bad. If you look over on the right, there's another graph that shows what percentage of AR is 60 to 90 days, 61 to 90 days old, and specifically that range. We like to show and highlight this measure because if your practice has a lot of AR, 60 to 90 days old, it's likely that you're reaching timely filing limit potentially on some of that AR. If you're seeing an upward trend on that, that's generally not good. Okay, because it just means that you have percentage-wise, a lot of your charges are 60 to 90 days old. You might want to follow up on that. Okay, so that measure is a good one to dig into and look at that trend. All right, so the practice here, where there's clearly an upward trend in recent months, they're up to 13% of AR in that 60 to 90 range. So I may want to go and jump into the EHR practice management, really dig in and filter on my AR, like the actual charges that are in that range, and have my billing folks follow up on that. Okay. All right, so jumping back to the practice management side, insurance aging summary. This is a key vital report for a summary of, by insurance company, how much money is outstanding in various aging categories. Okay, use this to monitor your percentage of AR for each insurance group. The report looks like this. All right, you have a column for each insurance and then total dollars of AR by aging category that are owed by that insurance. when you run this, it asks you, how do you want to age it? There's 3 different options: transaction date, posting date, and payer date. Payer date is generally what you want to do when you're looking at personal AR, and that means you're aging your balances based on when the patient or insurance became responsible for that charge. Okay? Yeah. This report is coming to the EHR. All right, I don't have a screenshot because it's actually being developed now. Kelsey showed this yesterday, where we're going to be adding in the EHR a insurance balance. I think it's called insurance balances or insurance work list. You're going to see something that looks very much like this: insurance groups, AR, and then you can drill in to each insurance and really get into a lot more detail about what's outstanding. That's coming in the EHR. Like I said, it's fresh and being developed right now. It's going to be a lot easier to follow up and track down AR with that next release coming soon. So again, coming to the EHR, you'll have much better tools for managing insurance AR. Same thing is true for personal AR. We are working, actually the delivery team that Tori and I work on, and Tamsin, who's in the back, and Chris, who's in the back, our team is working on a personal balance work list. So this is more of a billing tool, everyday billing tool for your practice. So personal tracking, personal AR tracking is going to be in the EHR as well, with the next release. All right, jumping over to productivity. Any questions billing AR or billing reports? The question is how often should you run the, like this one, this insurance AIG? I mean, this changes daily, this changes regularly. As a practice manager or clinician manager, I would say this is good to look at on a monthly basis at like, if not more, monthly at least. Yeah. Yes?
I think there's a chance that eventually it'll be so integrated that like you could take the personal balance, click on it, not only just know what it is, but has it been filed, has it been taken back, has it been, like, to get it all in one spot.
So the question was, do we envision having an integration where you can see a personal balance, click on it, and be able to track down like when it was last billed or when it was last billed to insurance? The answer is yes, yes. So we are developing and designing tools in the EHR that are going to be much more useful than what has been in practice management. So personal balances, I can speak to that because we're developing it now. You're going to be able to see families that have personal balances, click on it, and be able to get into payment posting tools and other tools that you can follow up with. That's going to evolve. So the first go around is going to just give you an access to payment posting and other things, notes, account notes, so you can have like your biller, if they're talking to the family, they can put in some notes about what they said. So a lot of new billing tools and functionality are coming. Yeah. Let's talk about productivity. So I want to spend some time because most of you, if you're a office manager, clinician manager, on a monthly basis, likely, you're looking at productivity for providers, charges, payments, visits, RVUs, combination of all of those. So we'll talk about that. We'll talk about some coding and patient volume reporting as well. All right, so in the EHR, we have, under the financial oversight category, a report called Total Charges and Payments by Provider and Month. All right, so this is new since the last UC, and it's really designed to be monthly reporting by provider, by location, by type, by procedure group as well, total charges and payments. Okay, we don't have visits in here yet, and I'll talk about that later. Charges and payments are in here. So practices use this for compensation, provider compensation. If you need to know how much did my providers generate for charges or payments in a given month, this report would be really useful for that. If you want to reconcile your payments to a bank deposit, always good to do, this report's good for that as well, because you can identify what was actually entered for payments for my practice attributed to a specific month. I'm going to go through some examples of this report. I'm actually going to go in and run it and show you how to customize that as well. All right, so like I said, you can restrict and subtotal this by provider, by location, by procedure group, combination of all of that stuff. Okay, so if you're a multi-location practice, you want to know how much location A had for charges versus location B, or provider A versus provider B, you could do that with this report. Let's talk about transaction versus posting date. This can get confusing. I talk with folks a lot about this. And I want to try to, my goal here over the next 5-10 minutes is to have people understand the difference between the two, when you'd want to run a report by transaction date or by posting date. Transaction date for charges, think of that as the date of service, the date of the visit. For payments, the transaction date is the date attributed to the payment. So like insurance payments, typically the date of the check. So if your billing folks are auto-posting insurance payments, all right, that insurance payment, that check that got direct deposited in your bank account has a date. All right, it's internal, and you can see that if you look at the ERA, there's a date. That's the transaction date for the payment. The system, while it's auto-posting, will automatically use that date when you're posting. Okay. For other payments, personal payments, or other payments that you're entering in, sometimes there's a date field that you can specify. And I'm thinking in the EHR or practice management payments that you're putting in, and this is again mostly personal payments. That date you put in there is the transaction date as well for the payment. Posting date, think of it as a system-generated date of physical posting in the system. All right, you can't control that. That's the date that it actually got put in the system. All right, those are different. For payments, they're often different. For charges, they're often different. If you're posting a visit a couple days after it happened, okay, the transaction date is the day the charges happened. The posting date is a couple days later when it got put in. For payments, those can differ as well. So you have, say it's June 30th, okay? You have a check. You're looking at your ERAs, your remits. You have a check that was deposited in your bank on June 30th, okay? July 2nd comes around, and that's when you're actually posting it in, okay? The transaction date for that check, for that payment posting, is June 30th. That's the date of the check. The posting date is July 2nd, when you actually physically put it in there. It's important to know those differences because when you're thinking about end-of-month reporting and maybe reconciling to a bank account, all right, you're typically looking at transaction date. You can run reports different ways in PCC, and knowing that difference is important. So here's an example. It's the end of the month, trying to reconcile payments deposited into my bank account for a given month with payments entered in PCC. So my bank account shows $50,000 of payments were deposited in this month. And I want to make sure in PCC that I have a number really, really close, if not exactly the same as 50,000 for that month, okay? When I run a report in PCC for payments, how should I do that? Posting date only? How many think posting date only? How many think transaction date only? Or how many think a combination of both? Okay. The answer is actually transaction date only. In practice management with the day sheet, what we call the day sheet report, which I'm not going to show because we have this new report, then you'd probably want to do both posting date, transaction date, just the way that report was designed. the EHR report that I'm going to show you, for this scenario of reconciling a month of payments to your bank account, transaction date only is best, okay? If you're running a report showing productivity for provider payments, like how much should be attributed to each provider for the month of June, you may want to run that by posting date. Okay, you want to say, okay, what did I post in a given month for each provider? Which is something that won't change the following month, right? I can't post more things. I can't back post things for the prior month. So for productivity reporting, posting date might be good. Okay, now I'm going to show you how this report can be run. I'm going to show you how to customize it by location, by procedure group, and show different levels here. So let me flip over to the EHR, and yeah, you can see that there. All right, under Report Library, so this lives in the Financial Oversight category. My user is sort of limited to different reports here. You can manage categories and have different roles of users at your practice seeing different reports. That's why you don't see much here where you may see more. But under Financial Oversight, this one here, total charges and payments by provider and month. If I run this for last calendar month, the month of June, I'm going to run it as it is here by default. There's nothing for June. Let me go back further. This is our users conference database. Let's run back to, let me go a longer range just to see what we have here. Oh, great. Okay, let's see. Thank you. Let's run that. No, all right. Yeah, we're at our users conference database. I had hoped to jump into another sample database, but, 2023. All right, so you're seeing by default, it's designed to be breakout by provider and month. Okay, so if you give it a long month range, you'll see. But so let me actually run this for 1 month. Normally, when you're running this, you may run it for 1 month. So I'm going to choose the month of March. Okay. Yeah, so you see total charges and payments by month. Just to show you how to customize this, because I want to make sure folks know how to work with these reports. If you click Customize, you have different options here of other things to show. So if I wanted to add a location breakout and perhaps a procedure group breakout, I can do that. Let's do that, just that for now. Let's take a look here. So now I have a total or a breakout or a column for different locations, different procedure groups. I can choose to subtotal or group this by location. So I have a section for each location now. Notice that you have procedure group breakouts here. So if you're a practice that when you're looking at provider charges or payments, you like to exclude immunizations. All right, you don't want to count that in their productivity. You can do that with this report. There is a filter down here of exclude by procedure. So I can go in here and say, I want to exclude, and I'm just searching up here. I get my procedure group of IMS, so I can just select all of them. I don't have to individually select them. Okay, so that'll get all of my immunizations, so I can exclude that and run this report. Now the totals that I'm going to see will exclude IMS. Okay, alternatively, you can include everything and just have that procedure group of IMS there that you can leave out if you're exporting this to a spreadsheet and working with that. You can move things around. So, oops.
Can you give a subtotal for each provider in the report?
Yeah, let me show you. Let me show you that. So you can move columns around. So the question was, can you do a subtotal by provider? I can change this. So now I'm looking at Dr. Casey, just her, and there's a subtotal for her. You can collapse different sections if you wanted to. A lot of people are going to save this as a spreadsheet and work with it in a spreadsheet, but you can group by different things there.
How did you do that?
I changed the group by.
Gotcha. Okay.
Yeah. Yeah, so I wanted to show you just how you can customize this report. I mentioned if you're running this as a productivity report, you may not want to run it as a transaction date filter, but instead use posting date. Okay? If you select criteria, all right, this is specifying the criteria options that you have here, and change this to posting date instead of transaction. Okay? Now I'm prompting for a posting date range. Okay? So I'm just customizing this report, and I used a full open posting date range there. So once you have the version you like, you can save it. So you may want to have this as the last. I was looking for a last. A lot of folks will do last calendar month. And I'm not going to get data here because I know there's nothing in here. But you can save it so that you have this report. You can name it what you want, describe it what you want. So anyway, I just wanted to show you how you can run those reports and customize that a little bit. Let's jump back. Okay. Yes, question?
You mentioned the day sheet and partner, and instead pulling this report. Is that what you were suggesting?
Yeah. Yeah. Instead, so the day sheet was designed to do something very similar, which is charges, payments. You could get more detail. A lot of people use the day sheet by provider or by month. This will give you better results or similar results to the day sheet. It has the same purpose. I recommend this versus the day sheet because it's easier to use, and the date criteria restrictions are easier to understand. I did want to show that you can also display. I don't have it here. Let me go back. You can display more columns, including different payment types. So here, I just want to point out you can have service charges versus non-service charges. The non-service charges would be a column of like your form fees, billing fees, or other non-medical fees, medical charges. So you can separate those out. You can separate insurance versus personal, cash, check, credit card. These columns aren't on by default, but you can customize to include those additional columns. Very much like Daysheet. So these are all columns that Daysheet could have. Daysheet actually couldn't have location, like where the service actually happened. So that is something you can get in here. Refunds are listed here, so you'll see for each provider any insurance takebacks or patient refunds separated out into their own column. Yeah, so very useful report. If you haven't explored it, check it out a little later. Talk about visit reports. Okay. Right now, we don't have visit reports in the EHR. That will come soon. All right, we're working on adding new reports to the report library constantly. We're working on some other stuff now. Visits is something we plan to take on very soon, just so you're not having to rely on practice management for just visit reporting. But right now, under SRS, under Smart Report Suite, under visit report category, you'll see a variety of visit reports. I'm going to highlight just a couple that I think are useful here. One is under the provider productivity reports category, total visits, charges, and payments by provider. Okay? This is just a grand total for each provider for the given time period you choose there. Total number of visits. All visit types are in here. All right, sick, well, immunization only, miscellaneous, whatever. The charges and payments you see are attributed to those visits. People get hung up on this often. When you're running a visit report, specifically the payment amounts, this isn't payments you've collected in that time period you're looking at. These are visits, or these are payments collected on those visits. All right? So revenue and charges for those visits. Not necessarily revenue and charges that are coming in that month that you're looking at. So it's visits and revenue, visits and charges for those, or payments and charges for those visits. Okay. That's a provider total visit report. When you're running visit reports, if you're a practice that posts a lot of form fees or missed no-show fees or other miscellaneous non-service revenue fees, you can run visit reports with a special restriction of include only revenue. That will only count true visits, not charges that for miscellaneous or non-service stuff. Okay, you can add that restriction in there. When you run visit reports, you generally want to have that restriction there. And I'll show you. I'm going to walk through an example of running that in a second here. Provider visit breakdown. Okay, if you want to know how many well visits did each provider do, how many sick visits, immunization only visits, hospital visits, consults, various visit types. This report is good for that. It's called per visit analysis by provider grouped by visit type. Okay, and you'll see this under the provider productivity category. There's another one called per visit analysis grouped by visit code. That's going to be a lot more detailed. That's going to have a subtotal for every CPT code for each category of visits. Okay. So that's a great way to get a breakdown of different types of visits for each provider. Categories, just a little bit about visit categories. These are defined in these visit reports for sick and well and consult, hospital, counseling, vaccine only. If you're doing telemedicine, so the telephone or portal, email, telemedicine, you'll see those split out into their own category. You'll also see a miscellaneous, which is everything else that doesn't fit one of those other categories. And the way that our reports categorize or count visits are based on CPT code, build CPT code, okay? If you have a well and a sick code on the same day, which can happen often, that is categorized as a well visit. So we don't count it as two visits. We don't count it as a well and sick. We count it as one well visit. So that's a little bit about visit categories. All right, so I'm just going to jump over to the productivity report, and I'll show you a little bit about how to run those reports. Jump over here. I'm going to go, again, this is in practice management, so I got to go to File and open up a practice management window. All right, I got to pick a valid location, hopefully. Whoops. All right. Oh. Let's try a different. Was there a specific one I should choose, Louis? Winner's Pizza, okay. And, yep, you're right, okay. Under partner reports, practice management / financial reports, you'll find Smart Report Suite. So this is where I'm talking about. You'll see various categories here. Provider productivity reports is where I was going to go here. I mentioned this one, total visits, charges, payments by provider. Let's take a look at that. Okay, it was 23, so I'm going to run all the way back to 23. Let's just look at half that year. Okay, I'm going to F1, and I'll just run it as it is. Okay, so yeah, you run the report, you get your columns like I showed in that screenshot earlier. All right, let's take a look at a total visits by, actually I want to look at the other one here, grouped by visit type. And I want to mention how to add that restriction of including only revenue charges. Remember I suggested that especially if you're a practice that has a lot of no-show fees or form fees added, you're going to hit F8 here. And you'll see a list of criteria. Shift 8 or your asterisk will bring up a list of choices. And you'll see visit include only revenue charges. I'm going to restrict on that and run my report. Okay, so now you see you have a section for each different visit type and each provider, total visits for each provider. Yeah, so I'm getting a lot of miscellaneous visits for these providers. So again, if you see that, if you run this at your office, and I encourage you all to look at this if you haven't already, if you're getting a lot of miscellaneous visits, reach out to us. Talk with PCC client advocates or myself, and we can clarify what the miscellaneous visits really are. I chose to restrict this to include only revenue charges, so I should not be getting many miscellaneous visits here or form fees or anything like that, because those are not revenue. You could have a misconfiguration on your system that causes those fees to count as visits. All right, I see that often. So when you run this, if you have a lot of miscellaneous, reach out to us. We can explain what those would be and identify if there's a configuration issue. All right, so that's visit reporting. You can customize these reports. So again, we have stock reports here for visits, but if you wanted like a trend report that you really wanted subtotals by provider by month, there is total visits by provider and month here, but if you don't like how that subtotals, let us know. We can customize these reports or group them in different ways. These reports can all easily export to a spreadsheet format as well. Okay? That's about visit reporting. Any questions about visit reporting? All right. Whoops. There we go. Okay. All right. Question in the back. Yep.
When we do those constant visits that are the well and the sick together, is there a way to run in there how many of them?
That's a good question. So the question was, is there a way to identify how many well and sick are done together? At the moment, there is not. Yeah, we don't have a good way to do that. That is something, like I said earlier, we're moving a lot of reports over to the report library. It is something we would like to be able to, we get that question a lot. It would be a great thing to add in our report library. So we'll keep that in mind as we look to add new reports in there.
I'd like
Yeah.
to do the supersized visit.
Yeah.
Just tracking that, because that's one of the things we're trying to ask our
Yeah.
folks to do, but
Yeah.
having a way to easily, and that would be a great dashboard report too.
Yeah, so yeah, Dr. Diazio seconded that, like we want to identify the supersized visits, right? Yeah, everybody wants that. And dashboard. So we've done this, if you want to know, I feel like we may have some, your CAs may be able to dig into this a little bit more. So that's, for the time being, reach out to a CA. We have a spreadsheet, a more detailed analysis that we do for consulting that breaks out different things like that, or percentages. We might be able to dig into that. I can't recall exactly if that's in there, but we will keep it in mind. Tori is our business analyst, by the way. I haven't introduced Tori. Business analyst for our reporting and forms team that I work with, and Tamsin and Chris in the back do work on testing, QA and testing for that team. We're making notes. Yeah. Oh, missed appointment rate. Any other questions about visit reports? Yeah.
You said the provider reports are best run by posting.
If you're running it, yeah. So the question is our provider reports best run by posting date. If you're wanting to attribute productivity for charges or payments for a specific month and sort of lock it down once that month ends, then yes, by posting date in the EHR is appropriate for that. It does not, in practice management, if you're running payment reports by posting date, this gets into the weeds a little bit, but like there's relink scenarios. Payments are constantly being relinked, all right? Like you get a payment comes in, or maybe a credit, and it's not linked to anything. Later on, that pays something off. That later gets reposted and relinked. You don't necessarily want to count that as two postings, right? When it gets originally posted and then relinked, we don't want to count that twice. The EHR report does not. Practice management reports for payments, you have to have that exclude relinked restriction in there for that. Yeah.
Can you come up with a little cheat sheet that we could use how to run by post, like charges, receipts, whether to use posting or transaction date for each of those? I know you had that one.
Yeah. So yes. The question is can we come up with a cheat sheet of reports to run and how to run it? Is that kind of what you're asking?
Depending on whether you're in charges or in receipts, whether
Yeah.
you would, and what you're trying to find there.
Yeah. So
Like defining what that, like an example, if you're trying to do X, yes.
Yes.
Then you should use charges by posting.
yeah.
If you're trying to do this, or at least come up with one example of each.
Yeah.
Like, here's a good example of when you would use charges by posting date.
Yeah.
Here's a good example of when you would use charges by receipt date. When you get to receipts, here's a good example of when you know.
Yeah. So yeah, the wish for folks who can't hear is like you get cheat sheets or better documentation or better examples explaining how to run reports for different situations. That's the tricky part. Is like if you're looking to reconcile to a given month of bank deposits, you're going to want to run it by transaction date. But provider productivity reporting, where you want to sort of have a hard cutoff at the end of the month and capture everything like posted in a given month, posting date. So yes, we will make a note of that. So that page that I showed at the beginning that had the QR code, so that page is designed to be a cheat sheet, really, of vital reports to run. It would be good for us to update that, like with an example like that.
That's very helpful.
My sort of yes and to that would be, can we have words mean only one thing?
Yeah.
So like, I mean,
Yeah.
it's like data visit, right? Like that has only one meaning,
Yeah.
right? So rather than using posting from all, and I totally get the history of how we got there, but if we're
Yeah.
moving over to one PCC, maybe we don't keep the same things we've always called it. Maybe it's an opportunity to rename. So data visit is always data visit.
Data visit. Yeah.
Date of insurance check is the date of the insurance check.
Yeah. So the wish for folks.
Date of entry.
The wish for folks streaming or that can't hear, having better nomenclature or descriptions for different dates. Yeah.
We
y-
recommend you run the report only that way, don't give us the choice.
so,
That's a core PCC.
yeah, we,
Put it in the EHR as you think it's best to run it.
right, yeah, so we try to do that with documentation, best practices, and that focus of like recommending you run in a certain way, yeah. PCC likes to provide customization, right? Like we like to give you the options, yeah, yeah. Yeah. All right, yeah.
So, I'm just trying to figure this out. So let's say I have a CPT code like a lipid panel, and I want to see how much I got paid on average last month. And I
Okay.
don't want any of them to be zero just because those payments haven't come in.
Okay. I'm going to get to that.
Okay, great.
Yeah,
Thank you.
yeah, I'm going to get to, so the question was, is I have a lipid panel was the one, like, I have a CPT code, I want to know how much am I getting paid on that code, but I want to make sure I'm only including stuff that actually got paid. All right, I'm going to show you the report for that. Yeah. All right, let's move on. I have till noon, right, Louis, Tori? Right? This ends at noon? Okay. There we go. All right, missed appointment rate. In the dashboard, missed appointment rate is a measure here. We update this monthly. I believe it's based on appointments from the last 3 months to make this sort of a snapshot of how you're doing right now for recent appointments. We give a benchmark for that. E&M visit coding. So we have a measure in the dashboard. It's called E&M visit coding that will show the percentage of visits, sick visits, coded as level 4 or 5. We added this many, many years ago because pediatricians were undercoding visits constantly. And we wanted to say, okay, show how much of your level 4 and 5 as a measure, as a percentage, are you billing? So there's a benchmark in there. There's top performers in there. The screenshot I have here may be a little outdated for the benchmark, but check out what you're at, okay? In the dashboard, if you scroll on, when you go to that E&M visit coding measure, scroll down, in related tools, there's a provider coding comparison link, all right? That will get you to a page that looks like this, where you can interactively say, okay, what start date, end date do I want? And you can restrict it to one provider or all providers, and you'll get your coding curve, full coding curve for that provider. So if you wanted to kind of look at this for different providers, you can do that.
Sorry, Tim.
Yeah.
I look at this every month. It's very helpful. For the people who are billing way too many 2 and 3s, is there a way then, I mean, I know there is a 15-step way to look at, well, that's because the nurse practitioners see a heck of a lot more quick six, you know? So those are gonna be 2 and 3s. Cough that yielded nothing.
Yeah.
Versus, like, what are those 2 and 3s for? Not, I saw a million 2 and 4s, and they saw a million 2 and 3s. They're undercoding. It's more like.
Yeah, you want to dig into this, get more insight into the different visit types of what types of, what are they really
Yeah,
for?
because when we go back and audit our NP, who has like 22% 914s, we're like horrified, but then when we actually audit and go into it,
Yeah.
she's right.
I want to, that's a great wish. Put it in the wishing well. Because, or Tori's keeping notes. It's a good wish. You want more insight, and we have a lot of thoughts and vision and for providing more data analytics and insight into the data that you have. Right now, the dashboard is specific. We collect specific data. We show specific data. Report library is also very specific. We give you reports. There's a certain level of customization. We want to expand that. And that's a good example of a good insight that would be good to have. All right. Active patient counts. Oh, yeah. Yeah, that's okay.
Springs here with missed appointment reporting. So our practice has been with PCC for 942 years. So missed appointments and how we code in missed appointments now are completely different. What is feeding into that report
So the question was, is how is this report calculating? It's based on appointment status. So your staff actually have to mark it as missed. So every appointment you can, if it's missed, you set that status to missed.
They hit remove, missed appointment, give a reason, that's going to be here as well as if they mark it as missed, say in practice management as they catch that somebody no-show.
Yes.
Okay.
Yes. If you remove an appointment and say practice, like removed it for practice reasons, it's not marked as missed.
Patient missed, so as long as we click that.
Missed.
That is also going to be
That's counted here.
different ways to do it.
Yes, that's counted here. It's not counting canceled appointments. It's not counting removals for practice reasons or deletions. It's counting if the person clicked missed. That's what triggers that. All right. Patient counts. In the dashboard, under the patient population tab, all right, you have an indication of patient volume trends at your practice, active patient counts. You have it broken out into different age ranges. What you see on that trend is a snapshot of dashboard collection each month. So you have a snapshot of your active patient counts each month, represented on the right, or a count by age group. You can restrict this to provider, that is primary care provider, that is PCP assigned to patients, is how that is filtered. This excludes inactive patients. So if you've flagged a patient as inactive or any other flag that is designated to be inactive, they will be excluded from this list. If they haven't had a visit in 3 years, they are automatically excluded from the list. So the dashboard does some exclusions based on flag or last visit date. How many new patients do I have? Just a quick mention, in SRS, under clinical reports, there's a new patients by visit type. The report as it stands is designed to show every patient that came in your reporting period that had a new patient code billed. So we're looking at new sick, new well, newborn, any new patient code. Okay, so this could be good to look at. Okay, how many new patients am I adding at my practice on a regular basis? This could be customized to show trend counts and so forth. Or age, yep. The question, where is this? Under SRS clinical reports. There's a category of clinical reports called new patients by visit type. All right, let's get into some strategic oversight reports. We have 12 minutes or so. In the dashboard, I mentioned this earlier, there's a financial pulse. Don't be alarmed when you see this drop a little bit next month. And it's just because we're changing the pricing or the scoring methodology for pricing and revenue per visit specifically. Revenue analysis. All right, this is going to get to Dr. Lavagna's question of how do I do how do I get a report of payments for specific CPT codes, or what is my revenue per visit for different insurances? So why do you do it? Insurance negotiations. So you need, if you're going to go to an insurance company and say, okay, we need to change our contract. They haven't changed in years. You need to do your homework and really know what you're getting paid for the procedures that you're doing and what other insurances are paying for those procedures. All right, so these reports that I'm going to show you are helpful for that. Revenue per visit is one. This is in the dashboard. It's total dollars collected divided by total visits. All right. I got the question last night. What visits are counted here? It's all visit types. Sick, well, immunization only are counted in here. All visit types. Revenue includes both insurance and personal payments, so it's all revenue. And I should add, it also includes posted capitation payments, incentive payments, or any payments that you're putting in, even if it's miscellaneous. Okay. the dashboard does let you look at this without immunizations. So there's a version just called revenue per visit that includes everything. There's revenue per visit without IMS, excludes immunization product revenue, okay? Immunization admin is included still, so it's just the immunization product revenue we leave out. And that's, I don't have a slide of that, but we do that revenue per visit without IMS. If you're in a state where you don't buy many IMS, okay, your revenue per visit is going to be lower just because you're not getting paid on those pricey immunizations. So this gives you a comparison of what your revenue per visit is without any immunization products, so compared to the benchmark, also calculated the same way. Revenue per visit by payer, okay? In practice management, again, these visit reports are in practice management. There's one called per visit analysis by payer under the visit reports category. When you run it, I'll mention a little bit about these restrictions here in a second, but this is what you get. Every insurance group, you get your total visits, total charges and charge amounts per visit, and payments per visit, okay? So this gives you just an overall high-level view of what your average revenue per visit is for different insurances, okay? So you can quickly see here, if you're not familiar already, like how much you're getting paid on average for Medicaid visits versus Blue Cross, or Blue Cross versus Aetna. So every insurance, that average deposited per visit column is really helpful to get an idea of how you're getting paid. When you run this report, I'm going to add a couple clarifications here. If you want to get a really accurate, up-to-date result for this, you may want to restrict this report to say, I only want to show visits and charges that have $0 due on them, okay? They've been paid, all right? I only want to count stuff that's been paid. You can add this charge amount due, and it's actually called visit amount due for visit, and specify 0 to 0. And when you run the report, you're pressing F8 to add that restriction criteria. And I know this gets tricky if you're not too familiar with running practice management reports. Let us know. We can help you. We can walk you through this in the resource center during the walk-in, or you can work with your CA on this. Restricting that allows you to include up-to-date visits that have only been paid. Including only revenue visits is also good to do. I mentioned this earlier, when you're counting visit reports or running visits, you don't want to include no-show or form fees. If you do a lot of that, add that include only revenue selection there too. All right, so that's what you get for that report. Dr. Lavagna, this is the report to answer your question from earlier. Payment analysis by CPT code. So what if you want to look at how much am I getting paid for this immunization compared for different insurances? How much am I getting paid for this lab procedure or screening or office visits or whatever? This is an RVU report. It's in the RVU reports category because it has some RVU calculations and pricing in there that I'm not going to get into here. But really when you run it, again, you can add that restriction of charge amount due of 0 to 0 to say, I only want to include stuff that's been paid, charges that have been paid. It will prompt you for procedures to include as well. You can select all, or you can select the common procedures you want. But this is what it's going to look like. All right, and I highlight the vaccine section here because this is, when I run this report for practices, and I've done it many times, the vaccines are often the place where you see an example like this, where your charge amount is the same as what you're getting paid. You can see this for visit code sometimes. What do you do if you see that? Well, you need to raise your price. Yeah. So regularly, this report is important to run on a regular basis. By regular, I mean maybe quarterly. at least. So if you're an administrator or clinician, you want to get an idea and a view of what you're actually getting paid for the work that you're doing. And these are averages over a period of time. Okay. Again, vaccines, especially new vaccines, I often see underpriced vaccines there, just because sometimes you don't know what to charge. Look at this, not just for vaccines, but all codes. Okay. Pricing analysis is a little bit more about pricing. Review all of your prices at least once a year. Or if you know that contracts are renewing, review your pricing. The report I just mentioned, I don't show it here, but it has columns that show your average charge, which is your price, and it has a column of calculated charge at X% of Medicare. That's why this is an RVU report. So you could use this also for a pricing analysis to see what would my price be at a higher percentage of Medicare. Ben, I think it's Ben, is doing a session tomorrow about pricing, setting prices. I could spend an hour just talking about that, so I'm not going to get into that. His session tomorrow will be good to look at. If you want to know more about how to run these reports, what percentage of Medicare should I look at, and how that all works, he'll get into that tomorrow. But just a couple thoughts about pricing is this changes all the time. You look at this on a regular basis because RVU values, the value of the procedures you're doing, changes regularly. All right, immunization admins changed over the last few years. Tons of changes on that, increases. Okay, if you haven't reviewed your prices for IMS admin specifically, you definitely want to check that out. Most insurance fee schedules are based on RVU values. So your contracts for most of your insurances are a certain percentage of Medicare. And these reports can be run to show what your price would be at a higher percentage of Medicare, or at a certain percent. Okay. Just a view of the benchmark. So if you're wondering, okay, what percentage of Medicare should I charge? These are the benchmarks. So this is the average over time for PCC clients. And there's been changes, and the value, and again, the RVU values change every year, so that's why some of these are changes. But so it's good to see practices are reviewing this regularly. They're heeding our advice, changing and increasing prices a little bit. All right, so benchmark, the dashboard has benchmarks for this. Pricing analysis. So this is a specific report designed for pricing analysis under SRS RVU reports, called pricing analysis. The one I just mentioned, the per procedure one, could also be used for that. This is more of a aggregate. It doesn't have the insurance breakdown. It's just every CPT code, what you're charging, what a different price would be at a different percentage of Medicare. And this is a sample of what that is. Again, Ben's really going to talk more about this tomorrow in that pricing session. All right, with just a couple minutes left, any last questions? I wanted to mention this again. This page has a lot of the reports I mentioned. I didn't get into all of them. Copay collection ratio is one I see here. I didn't mention that here. That's another billing oversight report. There's dozens and dozens of different reports that are mentioned on this page. It's good to look at. So refer to that. I do have, what financial areas? So this is a Slido. You may have done this. If you want to just jump in and let us know. I remember at the beginning I said, I'm hoping that you can get an idea of what you want to focus on at your practice when you go back. This is what I'm wondering here. Which financial areas at your practice do you feel need more oversight, that you really need to dig into further? And I'm happy to take any other questions folks have. Right after lunch, I'm going to be in the Resource Center right next door. We have our reporting walk-in clinic. So if you have reports that you want to get into, you can come over there. There'll be a few other PCC folks there. I saw her hand. Yeah.
With the EHR reports, do people have to be given user permission to access all reports, or can we break it down by types of reports, like
Yeah.
versus financial?
So the question was, is in the EHR reports, do people have to be given access to run them? There is the ability to restrict access. The financial oversight reports I mentioned, when we rolled those out, they were only accessible to, I forget which roles. So it's a role setting. So like users have different roles. Administrative roles would see those reports. So not all would see the financial reports I showed. But you have the ability to manage report access by role. Yeah, and we can work with you if you need to tweak that a little bit. All right, so it's interesting to see here, under payments is the biggest one. Just this word cloud is just indicating who's entering the most, or who's entering all the different, or voting up different reporting financial areas. So that's good to see. Under payment amount. So remember, allowable storage is really the only way you can use that report. You have to have the allowable stored in there. It takes some maintenance and upkeep.